Welcome everybody to the OPT Network. As we're heading straight toward Father's Day, June is also Men's Health Month. So we're taking time to talk about men's health, and here to talk about what we all need to know and understand is Chuck Mercer. He's a nurse practitioner at Christus St. Francis Cabrini Hospital. Chuck, good morning and welcome.
Good morning. Thank you for having me.
Absolutely. So we know that it is really, really hard to get the average man to the doctor. So most women are the catalyst to getting either their husbands or their fathers to the doctor. So what do you say to men who just don't want to have anything to do with the doctor? That's the first thing. How do we make it easier?
Okay, so men have to realize that it's not okay to be macho and not need to get in to see the doctor. It's not a sign of being weak just because you go see the doctor. It's actually a very good thing to take control of your health care and get things started earlier so we're not catching things too late, late in life. Because I've seen where men have come in late in life, have bragged about how they've never seen the doctor. And then we find things have taken them out, within just a year or two, because it was too late at that point. So.
And so you think that men take great pride in, I've never been to the doctor, or I've never had to see the doctor?
Yeah, I think there are a large number that do take that pride and that they haven't needed to be seen.
And so what are the health checks that women need to be saying to, because women usually schedule these things. What are the health checks and when should we start with men?
With men? So we can start early in life. In the 20s, it's recommended just to get a baseline annual wellness checkup. We can do baseline checks. Chemistry will give us all kinds of good information to make sure our electrolytes are where they need to be, make sure our kidney functions are where they need to be, check our liver function, kidney function, a CBC.
Blood pressure.
Blood pressure check. We can check for anemia. We can check a thyroid test just to make sure our thyroid is functioning properly. Cholesterol checks at least once every 5 years, as long as they're normal. If we have to start treating cholesterol, then we want it a little more often. The blood pressure checks, we highly recommend every year people getting flu shots. And now with COVID, we're encouraging people to get the COVID vaccine. So there's all sorts of things that we need to do to control our health.
And so as men progress in age, in their 30s and their 40s, what are some of the things that they need to be checked for and need to be mindful of?
Well, in your 40s, we start kind of being concerned a lot about, do we need to start checking prostate? The recommendations are now ages 55 to 64, checking the PSA, which is a blood test we can do. If you have a first-degree relative that's had prostate cancer, then we start that in the 40s. And then once we kind of get into the 50s, everybody, women including, we need to do colon cancer screenings. We can do that through colonoscopy. And there are some other tests that we can do, but the colonoscopy is the gold standard in checking for colon cancer screening.
Now let's talk about prostate cancer because the age has gone up, because I thought that the age for getting checked initially was 40. Has it gone up to 50 or 55?
Well, I looked at that this morning. And so the recommendations for doing a PSA, without any first degree relatives, is for 55 to 64. That is the current recommendation, or 69, shall I say. With the first degree relative, obviously we want to start that earlier. And a lot of times getting the actual prostate checked, a lot of times I'll defer that to a urologist who has a whole lot more experience in checking the prostate than I do.
And so statistics look like they're saying that 1 in 9 men will be affected by prostate cancer. So at some point, most men are going to have some issues with their prostates.
Yes, ma'am. And there's a lot of men out there that even have what we call benign prostatic hypertrophy, which is just an enlarged prostate. So they'll have some urinary issues the later we get in life.
And does that mean that they're going to want to urinate more frequently and get up during the night?
Oh, yeah, definitely. And, we make medications to kind of reduce that hypertrophy, give the men a little relief. Sometimes it can even cause some urinary retention. It can cause actually, what we call dribbling. After you urinate, you have a little leakage onto your underwear. So there is some things that will bother men if that happens.
But isn't that something that men can have those little issues and just think that it's age and just move past it?
Right, right. Just this morning, I had a gentleman. He was wanting to blame some of his fatigue and shortness of breath just on the fact that he felt like he was just getting older, and he didn't think that necessarily anything was wrong. Where I feel like we probably need to get him in to see a cardiologist to make sure that it's not his heart or it's his lungs. Same thing with the prostate. Yes, that is something that comes with age, but at the same time, if you're experiencing those issues, we want to make sure that there is no cancer involved that's causing the prostate to be too big.
Now, while we're on the prostate, I want to talk about men who have erectile dysfunction issues as they start to get older.
Okay.
And that's a really, really touchy subject, and one that men really don't want to confront. But what do you say to men that are having those issues, that feel that, again, it's probably because I'm getting older?
Well, yeah, so a lot of men, they're a lot more comfortable talking to me than they are a female provider.
Right.
But still, a lot of them, it's kind of hard for them to get that out, that they're having that issue. Obviously, there are some contraindications to using some of those medications like Viagra. So we rule those out first, and then I just talk to them openly about it. And it's a lot easier and it's a lot cheaper now to get those medications. Don't hesitate. Our sex life is very important to us. It's a crucial aspect of our life and our mental health well-being. So don't be afraid to talk about it and open up. And with me, I tell them it's no issue. I'm there for them, and I'll do everything in my power to help them resolve that issue.
Right. And sometimes the issue can be easily resolved if people would just come out, or a man would just come out and talk about it and talk about those issues. And you can probably maybe find a solution in many cases, can't you?
Absolutely. Yes, ma'am. Whether we use the Viagra or we get them into a urologist, they have other techniques they can do that doesn't involve the medications. So yeah, just open up. Even if they have a female provider, the providers are very professional. They know what kind of questions they're going to be asked. So we're all well informed usually on how to handle these issues. And if we're not, then we just get you to the person who can. The specialist who can help you.
Let's take a break here, Chuck. But when we come back, I want to talk about men and heart disease. And studies are showing that men are having heart attacks younger. And what is that attributed to? And when do we need to start to be concerned about heart health as it pertains to our men? Stay on point, everybody. We're back with more right after this. Welcome back, everybody, to the OPT Network. As June is not only Father's Day, we want to make sure that men are around for a very, very long time. And we know how challenging it can be to get men to the doctor. June is also Men's Health Awareness Month. And here to talk about that are our partners from Christus St. Francis Cabrini Hospital. Chuck Mercer is a nurse practitioner. And we're just talking about those important checks that men need to have. Before we went to break, I was asking about heart disease. We're seeing more men at younger ages having heart attacks. Do we know why we're seeing that?
Well, I'm going to be honest with you. I think one of those reasons is just our Western diet that we have. And, Louisiana, we have the best food in the world, but it's not cardiac friendly. I'm a prime example of that. I got a stent when I was 37.
Wow.
A lot of it's genetics. I had heart disease on both sides of my family. So, not knowing that growing up and not eating a whole lot of healthy vegetables when I was growing up kind of didn't help things. So, yeah, I just think our Western diet, obesity, diabetes, you see the increased risk of all those things kind of tie together. And so naturally, heart disease is going to start being more prevalent in our younger generations.
So take us back to your 37-year-old self, Chuck, and when you realized that you may be having a heart event. What did that look and feel like for you?
Well, for me, it was just walking. Maybe I play a little golf, and I was walking at the time, and I would notice just walking with my bag between shots, I was developing a little chest pain. And then at work, and actually I was working in the cath lab at the time where we actually put
Wow.
stents in all the time. I couldn't walk from one room to the next without having some little discomfort. So immediately I got in with one of our cardiologists, did a stress test, and next thing you know, got a stent. So
Did you
at least I didn't have a heart attack.
Right. Did you think, though, even with the family history, did you think that this was happening to your 37-year-old self?
Unfortunately, I kind of knew with me that's probably what was happening. Because of the way the symptoms were and because of basically my job and my history of working in the health field, I kind of knew what things to look for when it comes to reflux, which can cause chest pain, musculoskeletal injuries, which can cause chest pain. I knew all those, and I knew how my symptoms were reacting. They were worse with exertion. They would go away with rest. That's your typical signs of cardiac issues. And I know my family history and how strong it was. So I had a bad feeling. And,
Did you jump?
true.
Did you jump right on it, Chuck? When
I did. Once I developed the chest pain, yes, ma'am.
And so they go in and they stent you, and then what happens after that? Are you you're back to up to full speed, or are you now worried if you'll have other blockages?
Well, I did have other blockages at the time, but we just kind of monitored those because the one I had was pretty significant. So yeah, I mean, it's a concern. It's something I think about every day because now I'm 53. I haven't had another heart cath since then, just to kind of check things out. And my stent's still open, my blockages are open, but I attribute that to a lot to do with medication. I try to eat healthier than I did back then. I'm not 100% like I should be, but I do eat healthier. And that is a key component to heart disease and a lot of other of our health issues.
Let's talk diet. Absolutely. Let's talk about when men should see a cardiologist, but not just see a cardiologist, be able to have a conversation about their family history and about their own history. So,
typically, yes, if you're having any types of symptoms, even if you're feeling a little more fatigued, if you're feeling like your heart's giving you some funny beats every once in a while, a little more short of breath than you think you would be, and you want to attribute it to maybe the hot weather or something, that's a good starting point. And then once you kind of get into your 40s and 50s, if you do have a strong family history, you definitely want to kind of just get a baseline, just run in, get an appointment with a cardiologist, give them your family history and just tell them you just want to make sure that everything is okay, even if you're not having symptoms. And they can do, whether it be a stress echo, just a regular stress test, or a nuclear stress test. At least you can have the baseline stuff done. And so you have a good starting point. So if anything does change, cardiologist has images and information to know if there are changes that are coming.
But they can't really tell if you have blockages with those tests, or can they?
Well, a nuclear stress test, yes, it's not perfect, but it does give an idea of where there may be blockages. We're not seeing actual in the arteries like we do in the cath lab, but you can see areas of the heart that where the nuclear medicine not getting to like it should.
And so let's talk about diabetes and hypertension, especially as they pertain to various different cultures. The prevalence of diabetes and hypertension in African American men.
Oh, definitely. It's definitely higher, especially hypertension in the African American community. And that, along with the diabetes, once again, it kind of leads back to the heart disease, but it also leads to diabetic retinopathy. Even with hypertension, can affect the eyes. The diabetes affects the eyes. Both of them can affect the kidneys. So these are things that, in our African American community, we need to stay on top of these things and at least come in and get screened for blood pressure. Do your routine blood work, because if your glucose is elevated, then we need to start adding hemoglobin A1C and other tests to see if you're diabetic, so we can stay on top of these things so we don't end up with some of these kidney problems down the road where we end up on dialysis. We start losing our eyesight. Little wounds in our feet are not healing like they should. So definitely important.
And age is not a factor when it comes to those diseases, is it?
Well, it can be, because, as we get older, our organs just stop functioning like they should. Pancreas, we start seeing as you get older, your increased risk for developing type 2 diabetes is higher as you get older. Same thing with hypertension. Our arteries become stiffer and don't work quite as well. They're not as forgiving when they were younger. So once it becomes stiffer, every time our heart beats, that pressure increases because they don't give like they did when we were younger. So age does play a part, but you definitely can have hypertension when you're younger, and it's very, very important to catch that early.
And let's not forget that high blood pressure is the silent killer. There are very few symptoms when it comes to having high blood pressure.
Absolutely. And so those, yeah, I have patients come in a lot, and their blood pressure can be 200 over 110. They won't have a headache. They won't have any dizziness, lightheadedness. So those patients are kind of, yeah, that's bad for those patients, because untreated hypertension can lead to a lot of significant things. We talked about eyes, we talked about kidneys. Another thing is congestive heart failure. Your heart has to work against a higher pressure. It's going to become weaker later in life. And so congestive heart failure can be caused by the untreated hypertension.
Have you all been, in your experience, has medicine been effective when somebody has a high blood pressure of 200 over, some ridiculous number, 90 or 100? Is the medicine going to work to bring that pressure down and make the pressure more normalized in the body?
Yes, it does. Sometimes it may take to find, for that person, what's going to work best for them. Once we get to like stage 2 hypertension, we get our blood pressures over 160, over 100. We may have to go to multiple agents. And typically, if I get that high and somebody's not on blood pressure medicine, I do typically go to multiple agents, 2 or 3 medications to try to get their blood pressure controlled. There are studies out there that show that when blood pressures get that high, multiple agents, 2 or 3 blood pressure medicines, as compared to just trying one, improve their outcomes, and they have lesser issues down the road.
What's the most important thing, Chuck, you want to leave men with, but not just men, the women who love the men in their lives, about really taking better care of their health and taking that more seriously?
So our families love us. They want us around. Don't ignore signs and symptoms. Do our screenings. This goes for women. Mammograms, the colonoscopies. Screenings are an easy way for us to find cancers and treat those early in the process rather than it's too late. We need to take our health seriously. If you're having any signs or symptoms, don't delay. Seek a healthcare professional. And like in my case, I treat what I can. I try to get you, and I take very good care of my patients. And when stuff gets above where I feel I'm uncomfortable with, I'm going to get them to the expert to get them to take control of that situation for me.
There you go. Chuck, happy Father's Day for you.
Thank you.
And thank you so much for being an agent of change and having this conversation. It's not an easy one. It's necessary, and it's one that we have to encourage men all the time to seek the health care early, because we know that early detection is the key in curing just about everything. So thank you for doing this.
Sure, I appreciate it. Thank you for having me.
Indeed. Hey, everybody, stay on point. We're back after this.